Ectropion or lower lid retraction after blepharoplasty. The outermost corner of my lower left eyelid doesn't sit flat against my eye since my blepharoplasty. Also, I seem to be seeing a lot more of my lower rims now, and my eyes are constantly red. I don't suffer much irritation anymore. My chemosis has gone down with the consistent use of artificial tears, but water does get in my eyes when I wash my face, even with my eyes closed. Do I have ectropion and/or lower lid retraction? Is this likely to fix itself? I'm 2 weeks post-op.
Thank you for your question. You state in your question with the photos you submitted that you're 2 weeks after having lower eyelid surgery, and you described that the left lower eyelid is not touching the eye, and you want to know, is this ectropion or is this retraction, and what to expect moving forward. Well, certainly I can give you some guidance with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. Cosmetic oculofacial plastic surgery is a major focus in my practice, and in fact, revision cosmetic eyelid surgery is a very big part for patients who come to us from all over the world for problems similar to yourselves, such as eyelid retraction, which is extremely common. Now, before going into the details of your question, I have a lot of familiarity with the situations like yours, and I can certainly give you some guidance in the absence of a physical examination. So to begin with the photos you submitted, in the left eye, it is clear that the margin of the eyelid is away slightly from the eyeball. And so that technically is referred to as ectropion. Now, certainly, there are many degrees of ectropion, and this would be considered a very minimal ectropion. As far as the concern of the definition of eyelid retraction, I think it's important to just compare the two eyes as well as what your eyelid position was before surgery. Now, as to what causes this, I can describe to you what I would perceive from experience with treating other patients like yourself. Typically, when a doctor performs lower eyelid surgery from the outside, an incision is made underneath the eyelashes, and the fat pockets are reduced, and then any excess skin is trimmed, and the stitches are placed to close the eyelid. Now, this approach is called a transcutaneous approach. It means the incision's on the outside. Now, often this results in two challenges. One is there could be a slight skin shortage, or a significant one. And in addition, there's a muscle called the obicularis oculi muscle that tends to become a little bit dysfunctional. In other words, it's a muscle that is necessary to keep the eyelid against the eyeball, and temporarily there is a combination of swelling and something called a neuroapraxia, where there is a temporary reduction in the muscle tone from the nerve fibers going to the muscle that can also be contributing to this situation. Now, I've had many patients who have had much worse situations come to me this early after surgery because their eye was in potential danger in terms of vision. I actually operated on them sooner rather than later. In your situation, I think you have some time. Speak to your doctor about this, but in general, in my practice, when people like yourself come to me, I advise first lubricating drops to keep the eye moist. It's very important to maintain the health and function of the eye. In addition, it is routine for me to recommend massage. And this is something you should discuss with your doctor. This is not something that I would recommend you just do without consulting your doctor first. The point of massage is it kind of helps bring the eyelid into the proper position, helps to release any potential scar formation, and allows the eyelid to kind of gently be pushed into the proper position. It has been my experience that when it's slight like this, then it usually does get better on its own. And as long as you're happy with the eyelid position and the appearance, you're in good shape. So I think that without going into the semantics of what defines ectropion, what defines retraction, you need to look at the big picture and see, do you like the way the other eye looks, and what can you do to make the left eye look more like the right eye? And I think in this time frame, 2 weeks out, you probably have good odds of your eyelid moving into the proper position so that you can get a more symmetric and functional outcome. So talk to your doctor, discuss the option again of lubrication and massage, and see how things transpire over time. If things get worse or things continue to move in the right direction, these are things that clinically we may help us make decisions and strategize appropriately. But again, I think that the odds are in your favor based on the photos alone and this very slight amount of ectropion. I've seen situations where it was worse than this, and it did eventually move, the eyelid moved back into proper position. So I hope that was helpful. I wish you the best of luck, and thank you for your question.